Next, I will talk on the guidelines for clinical research. The Declaration of Helsinki is the ethical principle for medical research involving human subjects. That was issued by World Medical Association in 1964 and revised every few years, and the last revision was issued 2013. They require ethical justice and scientific validity, responsibility of investigators, review by ethics committee, registration of research to open access website, and disclosure of conflict of interest. Belmont Report was issued in 1976 by United States government. It is the ethical principles and guidelines for the protection of human subjects of research. They classified basic ethical principles into three categories. That is, respect of persons, benefits. Respect of persons includes informed consent and considerations to vulnerable persons, such as cognitively and mentally impaired persons and pregnant and so on. Benefits includes minimize risk of harms and maximize benefits. And the risks should be reasonable compared to the benefit. Justice includes that it should be fair among the people in burdens and benefits. For example, paupers, minorities, and employees shouldn't be systemically recruited only because of the easy availability. Here is rules and guidelines among countries. In registered clinical trials, GCP, good clinical practice, is commonly applied among the regions. For investigator-initiated clinical trials, the guidelines and rules are different among the countries. In Japan, the Clinical Trials Act and the ethical guidelines for life science and medical research involving human subjects are applied. Here are the rules and guidelines for clinical research in Japan. For registered trials for approval of medicinal products, Pharmaceutical and Medical Device Act, or PMDA Act, is applied, and also GCP guidelines applied. For investigator-driven or investigator-initiated clinical research, Clinical Trials Act or ethical guideline for life science and medical research involving human subjects are applied as illustrated previously. Now I will explain on the Clinical Trials Act that took effect in April 2018. This Clinical Trials Act is applied for clinical trials of medicinal products, that is, the drugs, medical device, and regenerative medicine products. Not applied to clinical trials other than medicinal products or observational research. English translation is located here. Here's the outline of requirements of the Clinical Trials Act. they require preparation of protocols according to the guidelines. Uniform style financial conflict of interest report, approval by certified centralized clinical research review committee, registration of official registration website, that is JRCT, and submission of protocol summary to MHLW, Minister of Health, Labor and Welfare. Report of serious adverse events to CRB, Centralized Review Board, and PMDA, Japanese FDA. In violation cases, they have to follow improvement order from MHLW. Next, I will explain about the ethical guideline for life science and medical research involving human subjects. New unified ethics guideline is implemented in June 1921. Here's the outline of requirements in ethical guideline. Clinical studies are categorized into two, that is intervention study and observation study. Intervention study is categorized into two, that is the intervention study with invasiveness and intervention study with low invasiveness. Ethics committee must report annually to MHLW on committee member list, activities, and the results of reviewing. Review by a single ethics committee is introduced in the new guideline. Researchers must register their studies to open database, that is the JRCT, before starting research, and the results after finishing study. Written informed consent or electronic informed consent is required. If the serious adverse event, SAE, happens, the researchers must report to institutional head and other collaborating institutions. In case of intervention study with invasiveness, and if the SAE is suspected to be related to intervention and unexpected, they have to report to MHLW. And also, the compensation to health injury and monitoring are required in intervention study with invasiveness. Chapter 6 in this guideline describes about the reliability of research, such as conflict of interest, storage of specimens, and storage of information, and monitoring and audit. Part 12 describes about the management of conflict of interest. Investigators shall report to the principal investigator concerning the status of conflict of interest to ensure transparency. The principal investigator shall understand the status of such research-related conflict of interest and describe it in the research protocol. Investigators shall provide information concerning the status of conflict of interest to the research subject in the course of procedures for obtaining informed consent. Part 13 describes about the storage of specimens and information. Investigators shall ensure that information utilized in research and records are accurate. When retaining human biological specimens and information, principal investigators shall describe means for storage in the research protocol in accordance with the operating procedures. Chief Executive of Research Institute must ensure that information will be retained for as long as possible. And for research which involves invasiveness and intervention, such information must be retained appropriately at least until 5 years have passed from the date of the end of the research report, or 3 years have passed from the date of final publication. Part 14 describes monitoring and audit. The principal investigator must secure the reliability of research. When carrying out invasive interventional study, they must perform monitoring and, as necessary, audit. Part 2 describes the terms and definitions. The term invasiveness means to cause injuries or distress to research subjects' body and or mind, such as puncture, incision, administration of drugs, irradiation, and questions related to the subject's mental trauma. The term intervention is normally means a practice for investigational purpose to control the presence or absence of factors which can affect a variety of events occurring in relation with human health. But in this guideline, the term intervention also includes medical technique beyond usual medical practice that is conducted for investigational